Hello there, you're welcome back once again to Zumeo. Zumeo gives you an exclusive and comprehensive information on women's health, parenting, family care, and relationship. So today, guys, we shall be discussing the 3 common problems of the vagina. But please, if you have not subscribed, kindly do that, and do not forget to turn on your notification bell so as to get notified whenever we upload. Thank you. So one thing is that these 3 common problems of the vagina have similar symptoms, but then their causes differs, likewise their treatment. But one advice I have for us is be sure of where you're getting tested. Yes, most of the time or some of the time, these people mistake the good bacteria to the harmful ones and then still prescribe for us. And when we get these medications, we are killing ourselves because actually nothing is wrong with us. But knowing exactly what you're battling with is crucial to getting rid of it immediately and effectively without complications. So we go over to the yeast infections. The yeast infections is the overgrowth of the fungus called Candida. This Candida lives in some part of our body. It lives in the mouth, in the throat, in the guts, in the vagina, and of course on the skin, but in a very smaller quantity, which doesn't cause any harm. However, use of some antibiotics, weaken the immune systems, uncontrolled diabetes can as well cause an upset in the balance of this bacteria, causing yeast to multiply. And what are some of the symptoms? Some of the symptoms are extreme itchiness, one. And then the second one is swelling of the vulva or the vagina, discomfort while urination, and painful sexual intercourse. No matter how the lady is being turned on, no matter how psychologically prepared she is for the act, she must experience the painful intercourse. So be sure to rule out before getting medications, especially when you're getting it over the counter, to avoid mistreatment that would cause your body to begin to resist some medications. So we go over to trichomoniasis, which is the second one. Trichomoniasis is caused by a parasite. It is common, it is curable, and of course it is spreadable too. Even with symptoms or without symptoms, you still spread it. So most women who have this does not even have symptoms. And for those who have symptoms, they experience vaginal discomfort, soreness, redness, and itchiness. They experience painful urination, they experience painful sex, they experience vaginal discharge that has a fishy smell or fishy odor, and of course pelvic pain, though very rare. Yes, but if you suspect this vaginosis, please, this trichomoniasis, it is very, very important you get yourself treated immediately with your partner, and also try as much as you can to refrain from any type of sexual intercourse until your dose of treatment is completed. Remember, I said earlier that it is spreadable. So once you have it, your partner automatically have it. You can give it to your partner anytime. So once when you're treating yourself, try as much as you can to get your partner treated as well. So the third one is bacterial vaginosis. Bacterial vaginosis is the main cause of vaginal discharge during a woman's reproductive age, and it occurs when there is more of harmful bacteria than the good ones. Example, when lactobacillus bacteria is being dominated or is being outgrown by the harmful bacteria. Then we have some risk factors of this bacterial vaginosis, which are pregnancies, having multiple sexual partners without the use of protections, the use of IUDs, intrauterine device, and of course, douching. So we have also their own symptoms. Remember, I said earlier that their symptoms are similar, but their causes are different. So what are the symptoms of this bacterial vaginosis? Number 1 is burning sensation during urination. Number 2 is painful sexual intercourse. Number 3 is fishy smell of the discharge coming out from the vagina. And then of course we have itchiness around the vagina area or around the genitals of the, yes, itchiness around the vaginal area. So please, when you suspect this or when you're diagnosed of this, try as much as you can to get it treated on time, because failure to do so, you are making yourself or keeping yourself at the risk of contracting some of the STIs and of course HIV. And for a pregnant woman who has bacterial vaginosis, she is advised to see her doctor to get medically treated, because failure to do so might end her up into giving birth to a premature baby or a baby with a low birth weight. So thank you guys for staying with us today. Thank you. And please, if you have not subscribed, kindly do that, and do not forget to turn on the notification bell so as to get notified whenever we upload. Thank you.